Members, it is time to start the meeting and we have a quorum. Let me call the meeting to order. In the legislative session 2012-13, up till the last meeting, we have already approved 9 projects, totaling a sum of $22.1565 billion, out of which 17.9 billion had to do with capital works projects. We have 4 discussion papers. They are for upgrading 4 projects to grade A, and they would total $5.326 billion. If all the projects would be supported by members, the cumulative projects approved would be 13, totaling $27.4825 billion, out of which a sum of $23.226 billion have to do with capital works. I'd like to remind members, if you have direct or indirect pecuniary interest relating to the projects under discussion today, please act according to Rules of Procedure 83A and disclose the relevant interest before discussion. I also draw your attention to ROP 84, which has to do with voting on projects with pecuniary interest. First of all, item 1, Head 705 Civil Engineering, PWSC 45. This is site formation and associated infrastructural works for development of columbarium, crematorium and related facilities at Sandy Ridge Cemetery. This is to upgrade the project to grade A or category A at an estimated cost of $66.4 million in money of the day prices, and also to retain remainder of the project in Cat B. The administration consulted the FSEH panel on the 11th of December 2012. Members supported the project in general, and the relevant discussion points have been provided at the meeting. Attending for the item today, we have Dr. Chan Shiu-chi, the Undersecretary for Food and Health. We also have the PAS, Ms. Wong from Bureau for Food and Health. We also have the Director of CEDD, Mr. Hon, and also Mr. Yong from CEDD, and also Mr. Young from the LCSD. Mr. Tam, this project has been with us for a long time. And as you know, we have a lack of columbarium in Hong Kong, and we really have to build more. Actually, Sandy Ridge is a suitable place. I'm only worried about transportation arrangements, because when people pay respect to their ancestors twice a year, and if this will be such a big-scale columbarium, transport facilities would have to be looked at. If you take the railway, you have to walk a long distance, but I don't think the place is well served by roads. I think we have to think more about the transport side. Yes? Professor Chen. Thank you, Mr. Tam, for your question on transport. Actually, with regard to the transport facilities and arrangements, we have already done initial assessment. Maybe I can ask the CEDD to give you more information. Yes, the Director. Indeed, we are paying attention. We have done the preliminary TIA. And as Mr. Tam said, most grave sweepers would be using the railway network. Apart from Lowu Station, some grave sweepers would be using other stations as well, because we have West Rail, people who come from the west, and also some others will come from the east. At different stations, there will be a package of facilities. They may not alight at Lowu and walk. They may alight at Kam Sheung Road Station or Fanning Station. And at those stations, we will provide complementary transport facilities, for example, feeder buses, to facilitate grave sweepers. The initial TIA has been done, and we believe we should be able to tackle it. We are now seeking money to do detailed design. When we do so, we will also do a detailed TIA, and we'll be watching this closely. Chairman, you said that Kam-lam should be the closest station. However, the roads serving Kam-lam are very narrow and they are very busy. And I like to draw your attention to that. And you said that at Shengshui or Kam Sheung Road, people can walk, you said. But how long will people have to walk? Or are there roads taking people to the columbarium from those stations? Director, people will not walk apart from the Lowu station. We'll have to provide feeder buses. At Shengshui, people would have to take a feeder bus for 7 minutes. Kam Sheung Road station, it is a bit far away. They may have to take a bus for half an hour. Mr. Tam mentioned Kam-lam, and he asked us about the transport facilities there. We have done an initial TIA as well. Basically, during peak hours at Kam-lam and also during grave sweeping seasons, the situation is different, but then we'll have to look at it again at the stage of detailed design. Wong, Chairman, I support the paper. I support the funding request. At the relevant panel, I also said that hopefully there should be as many niches as possible at this development, because such sites are difficult to find, and now we have got this big site. And as I said at the panel, I hope you can double the number of niches to be provided. I hope the administration will answer the question. I was told then that the administration would try to maximize the number of niches. Can I now be told here by the administration what they plan to do? Undersecretary. Thank you, Mr. Wong. Actually, we have already listened to the views of the panel, and we are going to provide 200,000 niches. This is already the biggest columbarium among the 24 potential sites in 18 districts that we have identified. Also, at this columbarium, there will still be some space which has been reserved for future development. If there is a need, we can make use of resources in order to do further investigation to see what development can be undertaken in the vicinity in order to add to the number of niches. Chairman, I'd like to be minuted to say that I have stated a strong request to the administration that there should be as many niches as possible. Ms. Emily Lau, thank you. I have a few questions. First of all, to follow up on what Mr. Wong asked, Para 6, 24 sites in 18 districts. Donald Zhang said there should be one site in each district. Now you have identified 24 sites. Is it that you have done away with the policy of having a columbarium in every district, or has it remained intact, especially now that you have identified 24 sites? The plan has been with us for over 10 years. And it is only by 2022 that you would be providing 200,000 niches at this site. But then what kind of demand are you going to meet by 2022? What percentage of the demand would you have met? And also transport. If you look at Annex 1, at Lowu Station, you have a road leading to the columbarium. Is it going to be very steep? And for how long people have to walk before they can access the columbarium? Undersecretary. Thank you for the questions. With regard to the policy, we still would like to provide one columbarium in each of the 18 districts. We have identified 24 sites. But then, it depends whether we can have successful negotiation with each district, we are facing huge challenges because residents may have their own views, and the environment and transportation, we still have to take up those with the district councils. So the policy remains, of course, if the site is bigger or if there is potential for development, we would of course like to maximize the number of niches so that if there would be any hiccup during the discussion period, we can still meet some of the demand. Secondly, the 200,000 figure and what percentage of the demand can be met. Can I ask the PAS to give you more information? PAS? Thank you, Chairman. We have identified 24 sites, and we are working at full steam to do research and also discussion. At Sandy Ridge, we provide 200,000 niches. In addition, we have other projects. In Zhangzhou, 110,000, Wahaf Shack, 104,000. Taken together, the supply would be in the tens of thousands. In December, at the panel meeting, we have already provided all the information to members. No, you have to let us know here and now. It is a very simple question. What percentage of the demand can you meet? Let us put it this way. Every year, cremation figures are nearly 50,000 in number. And if you have the 24 sites and also including private cemeteries, there would be a supply of 400,000. Therefore, in the foreseeable future, the supply will be able to meet demand. Well, these are just your planning figures. You still have to have the support of district councils and also endorsement of the legislative council. What about the road? Mr. Hon, for how long people have to walk? It is a barrier-free access. It measures about 1 kilometer. If people can walk 3 kilometers in an hour, it should take about 20 minutes. It is not going to be very steep. It may be a little steep at certain sections, but it is a barrier-free access. Mr. Ip Kwok Him. Thank you, Chairman. I'm not very familiar with the place, but I consulted the District Council. The North District Council, as stated in the paper, was consulted on the 11th of October, and district councillors showed general support, but they were also concerned about traffic and transportation and whether indeed the transportation network there can support the flow of people during the grave sweeping seasons. When you answered Mr. Tam Yu Chung, you said something. Now, I'd like to know more. What are you going to do after you have endorsement of this council? How can you liaise more closely with the district council in order to take care of their concern about traffic and transport? You said you would do TIAs, but the DC is quite worried about this. Can you give me more information? And that is, what are you planning to do after today, and what are the concrete measures? Director. Chairman, if we get the funding approval, we will engage a consultant engineer to do the detailed design work. And it would include an EIA, a detailed design, and what is important is the TIA. We will be considering the concerns of members in detail, and we promise that when we have the initial results, we can go back to the district council immediately to have an exchange of views with them, to gauge their views. This is done in the next step.
Mr. Yip. So when will the preliminary results be available, and when will you revert to the relevant district council? I would like to know the timetable. Well, we do not have a concrete timetable now, but after getting the funding, we will be hiring a consultant engineer, and in the middle of this year, we may get the engineer, and then we will discuss with him as to what the progress will be. And after engaging the consultant engineer, then we can go back to the district council and tell you more about the timetable. Yes, there should be more exchange of views. Mr. Abachet? Yes, I support this project. But I would like to know more about the timetable. Is there anything the government can do so that this can be sped up? Because now we are talking about 2022, and we will have to wait for 9 or 10 years. So for public works and development of new towns, you have to start with site formation, and then there are many phases of works, and it normally takes about 6 to 8 years, and I'm talking about a new town. And this is not too complicated a project, although there are some slopes, but it will take 9 years. And for the initial design stage, it will take 3 years. That's something that I cannot accept. If you look at paragraph 5 of the paper, you're saying that you will engage consultants in July 2013 to carry out the proposed detailed design and to supervise site investigation works for completion by September 2016. Well, it will take 3 years, although it includes investigation works. Many people are waiting for these kind of niches. We are not building a recreational site like the City Hall, and please take a look at the central government offices. It was built within a short period of time, and this is not a very complicated project. So why can't we speed it up? So let us not ask the people to wait for such a long time. Well, why do we have to wait for such a long time? Well, actually, we want to do it as fast as possible, but for these 3 years, it's actually necessary. We have to carry out a detailed design. So how much time was spent on the design of the CGO? Well, please wait for his answer. No, I don't need that. How about the CGO? We have been monitoring the construction of the CGO. If you want to do it fast, you can do it fast. Donald Tsang wanted to build the CGO, and it was done in a short time. It was a more complicated project. Well, Chairman, in the process, we have to conduct EIA, and we need data from 4 seasons. Well, you can do that simultaneously. Oh, for this site, it's not too complicated. Yes, I understand that sometimes you have to do A, and then afterwards you do B. And there may be some unexpected issues, and that may incur more costs. I understand all these. But we really want to build more columbarium, so some things can be done at the same time. Well, do we have representatives from the Bureau? Well, please let me explain. We have to carry out the EIA, and then we have to have it gazetted, because it's about road works, and that has to be gazetted. And also for the design work is actually done simultaneously. And then we need to seek for funding. So we're talking about 3 years, and actually it's already a compressed timetable. And during the process, if we discover that it can be shortened, we'll definitely try to do that. And the construction period is 6 years. Well, for the construction period, it's divided into 2 parts. First, we have to do the site formation. And as Mr. Abachan may know, there are some slopes there. They have to be handled, and we have to build retainment walls. So we also have to do investigation. And while we are working on the slopes, we have to be very careful. And there are some tunnels and footbridges, etc. And then we will make platforms. And then the ASD will have to construct buildings, which will be the columbarium. So that will take several years. I really cannot accept this timetable. Well, please speed up. Well, you told us just now that the road there would be a barrier-free one. So I think you really have to look at the crowd control, because, you know, during grave sweeping seasons, there will be huge crowds there. And we are talking about 200,000 niches. And there will be many people going there. And for the barrier-free access, those may not be able to be used by motor vehicles. So when there is a huge crowd there, you have to control the crowds. So how can the pedestrians be divided from the motor vehicles? You need a very careful design. So I hope that the barrier-free access can be used fully during those peak seasons. Thank you. Ms. Low. Thank you, Chairman. Well, the shortage of niches in Hong Kong is now a very serious social problem, so I support this project. Now the government is seeking funding and they will be doing some preliminary work, and I understand why some members are so concerned about the time frame. They really want to get it done as soon as possible. And I would like to ask a question about EIA. For site formation and the relevant infrastructural works, EIA would have to be done. So now the government is seeking funding, and I see that $8 million are now earmarked for this purpose. Now, under the present circumstances, and in view of the present situation, are there special environmental factors there so that you would have to do special work, and that may have an impact on the timetable? Would there be special factors like that? Director? We have looked at it, and we do not have the detailed data yet. And I don't think there are very difficult areas there. Well, some natural areas, some natural green areas will be affected, and we may have to do some greening afterwards, and that's the only point we have to pay particular attention to. Now, you have provided us with some information here, and it says that felling of trees would not be involved. Now, if you need to do this kind of work, you may need to clear some vegetation. So can you clarify? Yes, some natural woodlands would have to be cleared, and some plants would be affected. So we will conduct a detailed survey, and then we will know more details. Mr. Wu Chiwai. Thank you, Chairman. I support the construction of this columbarium, but I would like to ask two questions. Now, you will be relying on the Lorwu MTR station for transporting people, but have you talked to the MTRCL? Would they give a special rate to the passengers? Because if you use Shangshui Station and Lorwu Station, the fares, the fare levels are very different. And what will be the flow of the passengers? And in the paper, they said that there will be a barrier-free access, and it seems that it will link up Lorwu MTR station with the Sandy Ridge Cemetery. That is the boundary of the Sandy Ridge Cemetery. So for this barrier-free access, would it lead to all parts of the columbarium? Now, because there will be a lot of visitors there, so will there be travelators in the cemetery so that visitors can be transported as fast as possible? And we are talking about a huge area, and there will be 200,000 niches. So after conducting the preliminary works, will you open the cemetery in phases so that services can be provided as soon as possible? I would like to answer the third question, and as for the other two questions, the director may answer them. As for the 200,000 niches, they will be provided in phases, and we will be drawing lots in accordance with the past practice. We understand that there are people dying, so we know that they need niches, and so that these niches will be provided in phases. So he would like to know if the niches, if the cemetery will be open in phases. So that's what you will be doing, right? I would like to ask the director to answer this question. I mean the whole, well, for the whole columbarium, there will be 200,000 niches. So if you have constructed a certain number of niches, then those niches will be provided to people, right? That will be done in phases. That is, for example, if you have built 50,000 niches, those niches will be provided to people, right? Yes, that is so. And we have not talked to the MTRCL yet, but for our initial estimation, not all the passengers will be using the Lowell MTR station. We think that about 30% of the passengers will be using the Lowell station. As for the other passengers, they will be using other MTR stations, because there will be feeder buses taking the passengers to the cemetery. And if you use Lowell station, you have to walk the 1 kilometer long pathway. And this pathway is a barrier-free access. It's maybe steep in certain sections. So not the majority of the visitors will be using this pathway. Some other grave sweepers will be using other paths. Well, according to our observation, not many people would rely on the feeder buses. If you can discuss with the MTRCL, actually, Lowell Station would be most convenient. Now, we are talking about hundreds of thousands of visitors during the grave sweeping seasons. So it would be very difficult to evacuate all these people during peak seasons. If you have not discussed with the MTRCL, you really should do so, because the traffic arrangement is very important during peak seasons. So I suggest that the government talk to the MTRCL so as to ensure that the visitors can enjoy a lower rate while they travel to the Lowell station. It's not that we have never talked to them, but we have not talked to them about the fare. Well, the fare is very important when it comes to visiting this site during peak seasons. As to whether the passengers will walk or use the feeder bus after getting off the trains, we will have to discuss. We will have to look into the details later. Well, first of all, I support this project, and I hope that it can be completed as soon as possible. But when I look at the paper, actually, it's a very simple project. Because there is no heritage buildings to be conserved, and we do not have to fell a lot of trees, and there have been consultations and supports have been received. Now they only have to do site formation. So I don't know why we have to drag our feet, because if this kind of project would take such a long time, then we really cannot do anything. So can the government tell me, after they get the funding, when will the first batch of niches be available? Because they would have to build the relevant CNC facilities. Because now we really do not have enough niches in Hong Kong. So how can this project be sped up? This is my first question. And also I have another question. Just now, the government said that it has identified 24 potential sites in 18 districts. And lately, actually in the past few days, the government said that it had to deal with the housing problem, and 36 sites in different districts would have their land use changed. Now, because we do not know the details about these 36 sites, so would they be overlapping with this 24 potential sites?
because I don't want to see any more delay of the building of these niches. Can you answer the question? Director, as I said, we will try to compress the construction period, but actually let me say that this is actually not a small project. My estimation is that it is going to cost billions of dollars, and we'll have to form a huge site, and actually there are sloping works to be done. Also, we have to dig tunnels, we have to build elevated roads. So it's not an average small project. We can promise you we'll act fast, but I'd just like to clarify that point. But can you not tell me when the first batch of niches would be available? The timetable is 2022. Ms. Helena Wong, well, sorry, there is another question. The land issue. 36 sites and 24 potential sites. How do they relate? PAS. The 24 potential sites will not be affected by other works or projects. We are working at full steam. Ms. Helena Wong. Thank you. I don't belong to this committee, but I'd like to ask some questions. Yesterday, at the FSEH panel, we discussed that we do not have cremation for animals in Hong Kong, not anywhere in Hong Kong at all. My question is, since you are doing the design now, will you consider providing cremation services for animals as well? 1/10 of households in Hong Kong keep pets. This was mentioned yesterday at a panel meeting. Now that you have this new project, will you consider adding in a cremation service for animals? Under Secretary. Thank you for that view. Indeed, at the FSEH panel yesterday, we discussed this issue, and members said that hopefully we could have some public-operated animal cremation service. After the meeting yesterday, we would go back and discuss the issue. Yesterday, members gave us a lot of views, say whether we would have public cremation services for animals, and also whether we can add such services to existing crematoria. We will go back and give this active consideration. If there are no other questions, we'll put the item to the vote. Those in favor, please raise your hands. Thank you. Those against? I'm of the view that the majority of the members voting are in support of the item. The item is endorsed. Next paper, PWSC 2012-1346. 13 MD Redevelopment of Kwong Hospital. Members are invited to recommend to FCA the upgrading of part of 13 MD entitled Redevelopment of Kwong Hospital Preparatory Works to Cat A at an estimated cost of $552.7 million in money of the day prices. On the 11th of June, the administration consulted the Health Services Panel. Members in general supported the project, and the main points of discussion have been tabled. Attending to answer questions today, we have Professor Sylvia Chan, Undersecretary for Food and Health, PAS, Ms. Angela Lee, Mr. Leung Kam Pui, Chief Technical Consultant of the Architectural Services Department, and Dr. Nelson Watt, HCE, Kwong Hospital of the HA, and also Mr. Donald Lee, Chief Manager of the HA. Welcome to you all. Mr. Alan Leung, are you here? Dr. Leung Ka-lau, sorry. Dr. Leung Ka-lau, are you here? I'm here, Chairman. Okay, would you like to let members know what happened at the panel when this was discussed? Thank you, Chairman. On the 11th of June, the Health Services Panel discussed this proposed redevelopment program. Members generally supported the redevelopment of Kwong Hospital. However, they raised concern about a number of issues. For example, the increase in demand for medical services after redevelopment, the area for the pharmacy, and also whether there would be the relevant manpower contingent and how Chinese and Western medicine can be combined in order to provide better Chinese and Western hospitalization services. Members asked the administration to particularly consult members in the Kowloon West cluster and also members of staff of Kwong Hospital so that patients will not be affected during the redevelopment period. Thank you, Mr. Wong Kwok Hing. Chairman, I'm not a member of the HS panel. Those who would like to speak, please press the button. However, I would support wholeheartedly the redevelopment of Kwong Hospital. Kwong Hospital has aged and has served Hong Kong for a number of years. It needs redevelopment and expansion badly. I'm just concerned that during the redevelopment period, what would happen to the manpower contingent and how you can alleviate the pressure of staff. But at the same time, you will not reduce geriatric services. Can you answer the question? Any response? Thank you, Mr. Wong, for your view. Actually, the HA will be doing what it should to make arrangements to complement each stage of redevelopment. I can ask the hospital chief, Mr. Watt, to give you the details. Yes, Chairman. The actual redevelopment will be done after a detailed decanting program. The decanting program will be based on one principle, and that acute services, actually emergency and accident department services, will not be affected because it will only be developed in the second half. As to non-emergency services, they will be assessed and considered according to the categories they belong to. For example, ambulatory services or hospitalization, and then surgeries. All those will be the subject of detailed plans. As for outpatient services, the building for providing outpatient services will not be included in the redevelopment, so it will not be affected. As for surgeries, if the OT on certain floors will be affected by the first stage of redevelopment, the services will be extended and perhaps surgeries can also take place on Saturdays. So the basic principle is not to affect the provision of services. As for geriatric services, we are providing the service. We actually will also look after elderly people who return to homes for the elderly. We have outreach community assessment teams to provide the service outside the hospital. We assure you that these will not change. And as time progresses, we will be planning for such services for Kowloon West as a whole. I'm sure emergency services will not be affected by the redevelopment, and non-emergency services will be planned ahead of redevelopment. If there is going to be any impact, we will do planning in advance together with the cluster and make suitable arrangements so that there would not be a huge impact on the public. Ms. Chen Yun-han. Thank you, Chairman. We support the redevelopment program. It is a large-scale project. If I look at the plans, I can see that it is a huge project. Kwong Hospital is in a central location in Kowloon and is well patronized. It also provides Chinese medicine, so it's rather famous. This is a big change. Now, I don't know how you are going to handle it administratively. It is quite big. It is not the same as United Christian Hospital. It is just an extension, but this one will be redeveloped. What happens to the patients and medical staff, including frontline staff? I think many people have asked the same question, but I still need the details. And you said that there will not be any impact on the environment in the vicinity. I know the place well. The FTU is very close to Kwong. The roads there are very narrow. As you know, Gala shopping mall is just next to you. I think there will be a lot of pollution generated. United Christian and Queen Mary Hospital are not the same because they cover a bigger area, but this is in the middle of residential areas. It is in Mong Kok. Why will there be no impact on residents? Dr. Watt, thank you for the question. We will not lose sight of the impact on our staff and residents and patients during the redevelopment period, and that is why we have designed the plan so that there will be 2 stages. In other words, some floors will be demolished first, and other floors will continue to function as normal. During the different stages, people say bulldozers will go in, but that will not happen before 2015. In these 2 years, we are going to be able to communicate and make arrangements with staff. In fact, we have started short, medium, and long-term focus groups. And we have, in a way, dissected services and looked into them in detail. Each staff member will know where to go to. Some staff members are worried where they will be deployed to. But the major principle is not to affect services for the public. And under that principle, we will be telling staff that they will not be deployed out of their present posts. And we have dissected all the services. We have reviewed the details of services together with staff to see what works and what does not work. So we'll have a year or 2 to do the software planning. This is because I do understand that we are different from United Christian and Queen Mary Hospital. And then next to us, there is a primary school. Later on, when we have a more concrete plan, we will be talking to the primary school. We'll be telling them what mode of development will be undertaken. And if there are facilities a mile or 5 miles away from us, they should know what will happen. Of course, if they are right next to us, you know, the wheels of the bulldozers may be taller than a human being, and they should know it. And we will be telling these people who will be affected. And also on Dundas Street, there are residents, and the OCs will be contacted on a regular basis so that they know what to expect. We will furnish them with the latest information. We have a year or 2 on our hands before anything happens, and we will give them advance notice. And we may even go to the district councils, and we may even have an open day. So people can come to Kwong for information dissemination meetings. Many residents who care about Kwong can come to get hold of information about the progress of the project. Those who will be affected, we will liaise with them closely. But people who just want to know will also be informed. So the entire community will get to know what happens to Kwong. It is a huge project. It's going to take long, but we don't want the redevelopment to affect residents in the district and affect the provision of services. This project is going to take 10 years, and so we are going to do this on a regular basis. Chairman, he did not answer my question as to the arrangements within the hospital. As you know, there will be dust flying around. There will be patients while the project is underway. Will you engage more cleaning staff, for example? This is not the same as other hospitals because you provide many services which are very popular within a very small hospital. So what are you going to do? You really have to do a magic job. That is the worry of Ms. Chan.
So when you do the design and investigation, please pay more attention so that the nuisance caused to the public would be minimized. So we are just trying to upgrade part of the project to Category 1, and in the coming days you will need more communication with the community so that they will be less troubled. Ms. Chang, now what's the GFA now? And after the redevelopment, what will the GFA be? Chairman. Mr. Lee. At present, the GFA of Kwong Hospital is 110,000 square feet. And after the redevelopment, the GFA will be 200,000 square meters. So there will be an increase of 80%. Sorry, what's the increase? An increase of 80%. It will be increased by 90,000 square meters. So the area will be increased by 80%. And this is the first funding you are seeking. Is about $500 million, and in total the whole price tag will be over $10 billion. We are spending so much money, so what kind of services will be upgraded? Now here you say that there are 1,200 beds. And after the increase in the GFA and after spending so much money, what will the number of beds be? You are saying that the floor area will be increased by 50,000 square feet. So how about the number of beds? I have some other questions too. For the A&E department, now it's 1,800 square meters, and it will be increased to 5,000 square meters. And you have about 400 patients there every day. When it's increased to 5,000 square meters, how many more patients can you take care of each day? And also for the Chinese medicine beds, now there are about 50. And you plan to have 50 beds. So how about future development? Will there be space for further addition? Last question. And this is related to Ms. Chen Yinhan's question. You say that there will not be much impact on the present service. And can you tell me that what kind of impact will there be? Because Kwong Hospital is a very big hospital, and there are many patients going in and out every day. So now you are revamping the whole complex, so I don't think there will be no impact on patients and residents. So can you tell me more about that? I'd like to thank Ms. Chang for her questions. After the redevelopment, services will be optimized. Now our restriction is that there are many historical constraints. For example, buildings aging, and the loading is not enough, and new machines cannot be accommodated. So after the redevelopment, we have more GFA, and we can provide more space to our customers, and also there will be space for further development. For example, services can be expanded and more machines can be accommodated. As for the number of beds, other than providing beds to inpatient patients or inpatients, we also have a large-scale ambulatory service center, and these are not inpatients, and the patients will be coming in and out all the time. So it's not that they would have to come in and stay overnight and they would take up a bed, and then other patients cannot receive the same service. So in other words, it's not about the number of beds anymore. And also we will be introducing non-radioactive cancer treatment. And also Chinese medicine will be combined with Western medicine, and this will be a new service. Now, because we are very familiar with both Chinese and Western medicine, but after combining them, there will be a new type of service. I have given him 2 minutes, and he has not answered any of my questions. Well, he has answered your question. It's just that you are not satisfied. I'm asking about the number of beds. Now we have 1,200. And how many more will there be? And how about CM beds? Now there are 50. And how many beds will there be in the future? And how about the impact on patients? So he hasn't answered my questions at all. So, Mr. Watt, can you answer these questions? Well, doctor, please answer my questions. At least I would know. Please do not read out what you've written down. Yes, I understand. I think that there will be 56 beds. So after introducing the service, we will look at the direction, and then we will give you a concrete figure. There will be much more space, and there will be room for development. But as for actual operation, we will have to look at it when things are done. So it's very difficult for us to answer your question at this moment. Now we are looking at 56 beds, and this is our target right now. So it's very difficult to know. Okay, you have answered me. I hope that when you seek funding next time, please give us more accurate information. Ms. McMakin? I think both I and Chen Yun Han share the same view. We think it's very difficult for the HA staff to work now, because this is a very constricted site, and you have to do redevelopment, and it's actually better to relocate the hospital. Can some of the patients be served by Notre Dame Hospital, or can some of them be served in Wong, etc.? Well, I don't think that can be done at the moment. But I think during the redevelopment, you really have to consider the impact on healthcare staff and patients. As Ms. Chen Yun Han said just now, it's actually a very difficult job for the cleaning ladies during construction. I hope that manpower can be increased for this purpose. And just now we were told that services for patients will not be affected. Unfortunately, a few days ago, I got this complaint. There is this brain sickness patient, and he's hospitalized. And he was told that there was another more urgent case, so he didn't have his operation in time, and he died. So in the course of redevelopment, how can this kind of incidents be avoided? Because we are talking about people's lives. And also for the OTs, there will be new facilities. So can we avoid this kind of accidents in the future? I would like to thank the member for her views. As for Notre Dame Hospital, it is another hospital in the Kowloon West cluster. And while we try to maintain our services during the constructions, this is our partner hospital. So now, before the actual demolition work, we have 1 to 2 years to plan. That is exactly to handle the problems the member mentioned just now. Well, my question is very simple. I'm not talking about this particular case. I want to ask you, during the redevelopment, can you ensure that the patients can receive timely treatments and they will not be affected? And after the redevelopment, the services provided to the patients will be bettered? Yes, we are not just talking about the redevelopment. All the time we will ensure the safety of the patients. You have not answered my question. Well, if you just give me answers like this, well, I cannot do anything. However, if that is the case, I will definitely follow up on this case I mentioned just now. Mr. Mlangsing. Well, most of the members support the redevelopment of Kwong Hospital because it was built in 1911. There are a lot of memories about this hospital, and sometimes when we talk about collective memories, we do not redevelop the relevant buildings, and I'm happy that this does not happen to Kwong Hospital. And now we have many redevelopment programs in Hong Kong, and the Hong Kong government is trying to find sites for new housing projects. So when I look at your preliminary works, you already need more than 100 workers, and I'm sure at the end of the day you will need many more workers. And there are many construction projects in Hong Kong, and there may be a shortage of workers. I think now the shortage rate is 15%. So the progress of your project may be affected. Well, first of all, I hope that local workers would be protected. But if you want to import workers, I wonder if the government has made any assessment. Because you have to continue to provide services, and if you do not have enough workers, then the progress of your works would be affected, and that would in turn influence the patients. So what kind of backup options do you have? And also I have another question. There are many schools in the vicinity of Kwong Hospital. So how about noise pollution? Have you made any assessments? How can you make sure that the impact on the nearby schools will be minimized? Mr. Watt. Maybe I can answer the last question first. That is about the impact on surrounding schools. Yes, I understand that we have Lang Yu Chik Primary School next to us. And while construction is underway, there would definitely be noise. So we will liaise with these people in the surrounding buildings. For example, in the schools nearby, they may have examinations and they may have some activities. So we will talk to them, and we will try to minimize the noise impact on them. As for manpower, maybe my colleague can answer the question. As for the shortage of construction workers, yes, we all understand that this is a fact. As for the number of workers we need, we don't need that many when it's compared with other infrastructural projects. However, when we do the detailed design, we will look at the construction methods and try to find the best way out. For example, we can use prefabricated building components so that we do not need so many construction workers. I would like to follow up. Well, for this particular project, you may not have a huge manpower problem. However, we still have some other projects. For example, in the following paper, we'll be talking about Tin Shui Wai Hospital, and they will need thousands of construction workers. So I hope that the government can look at it in a comprehensive manner. So we're not just talking about Kwong Hospital. Do we really have enough construction workers? Does the government have a contingency plan, or has the government talked to the workers' unions so that these factors can be considered?
I hope you will consider the projects together, not just the Kwong Hospital. Can you respond? The PAS. Or you can speak. The Development Bureau at other fora has already given the detailed information, but I will give a simple response. The CITA and also the Development Bureau will do the combined assessment. We have enough workers. Starting from 2005, we have started to register workers, so we know the number. We have enough workers, but then there is a lack of workers in certain trades. We'll concentrate on those trades and do training. As Dr. Watt said, apart from training, we will encourage contractors to adopt methodologies that do not require such a big number of workers. Thank you. Undersecretary, a question was asked by Mr. Ng Leung Sing but was not answered. Well, many other members asked the same question. That is, patients might be affected during redevelopment. What ways and means do you have? Because to take care of patients, because some of the services might be suspended and patients will be inconvenienced. Would you be streaming patients to other hospitals, for example, so they can take care of some of the medical services you usually provide? Thank you, members, for asking that question. Dr. Watt answered part of that question. Whenever there is redevelopment or any alteration within hospitals, the overriding principle is that the impact should be minimized. And if there is any impact, there must be a measure to make the arrangements. At the hospital authority, every cluster includes 6 to 7 hospitals. If Kwong is to be redeveloped, then some other hospitals in the same cluster, which do not have such a big number of patients, can help. In terms of planning, there can be decanting on the level of floors and even buildings. I'm sure the hospital authority will have in mind minimizing the impact on patients in mind. This will happen amongst hospitals within clusters. I hope this matter can be followed up at the FSCH panel in future, all right? Or the Food and Health panel. Next member, Albert Chan. Chairman, just now Mr. Ng Leung Sing said that people did not stand in the way of the redevelopment because of heritage preservation, etc. For me, I have a lot of memories about this hospital because I was born there and I feel nostalgic about the hospital. But then, of course, it has to be redeveloped. I'd like to ask the administration whether you have thought about relocating the hospital and release the land here, because the project is going to take 10 years and it's going to be a long period. Recently, Yen Chai Hospital only wanted to remove 2 floors and there was already a lot of impact made. You're going to do decanting, etc. So in terms of cost effectiveness, land use and design, there will be a lot of problems. But I think by relocating the entire hospital to another site, I think that would be easier. I'd like to ask whether you thought about this. Well, in the end, of course, you're going to undertake this redevelopment, but I still would like to warn you that you should try to minimize the impact. Dr. Watt or Undersecretary? I can kick off. Thank you, Mr. Chen, for the question. we have considered whether we should have on-site redevelopment or relocation whenever it is about hospitals. Such sites are so big, the construction time will be long, and certainly there will be impact made. If that's the case, we will certainly consult residents and also district councils. During the consultation, I'm sure district councils and also like Mr. Chan, they might somehow feel nostalgic about some hospitals. And some people may like to preserve the hospitals at their present sites. And that is why, in the end, we have decided to do on-site reconstruction. Dr. Watt? Thank you, Chairman. I subscribe to what the Undersecretary said. We commissioned a consultancy study. We also consulted residents and our staff. And the conclusion was, as the Undersecretary said, we would like to have on-site redevelopment and at the same time preserving the services. Mr. Albert Chan, I'd like to declare that I'm a consultant of the Tung Group of Hospitals. Wu Chi-wai? Chairman, I support redevelopment of Kwong. I'd just like to know that according to the plan, there will be redevelopment in stages. Are we going to know the different stages only when there is a detailed plan, or can you now supply the information to tell us what the different stages will be like? It seems there will be just one main building in the end. I don't understand how you can have one big main building so that you can decant the services while you build the building. I don't understand that. Dr. Watt, how can you decant services when you have just one main building? Thank you for the question. There are 7 buildings. One was built in 1997, the specialist outpatient clinic building that will not be demolished. The remaining 6, the first 3 will be in a cluster and they will be demolished. There will be one building that will be built there. It will be much taller, and the floor space will make use of all the space in between the original 3 buildings. As we were explaining to members, there will be an increase of 80% in floor space, so it can already also cover clinical services in the 3 other buildings to be demolished. In other words, when we have stage 1 completed, indeed we can already accommodate all the services in the existing 6 buildings. And then in the second stage, we will demolish the remaining 3 buildings so that we do not make a huge impact. Is it that in the end there will just be one big building or 2 buildings resulting? Because if you look at enclosure 1, there is just one big main building. Chairman, as Dr. Watt said, we will demolish half the buildings and then we will build one big building there and then demolish the other half of the buildings. We do not have the detailed design of the resultant building, but we believe the bottom part will be combined, but above they will look like 2 buildings. This is our estimate, but we'll have to wait for the consultant engineer to do the detailed design first. Last point. This is a big project. Are you going to have to increase the establishment in order to take care of your work in the future? Dr. Watt. Thank you. Exactly. We are concerned about this. Some services may have to be decanted to buildings to be demolished, and the services might be divided up into different quarters of the hospital, so there might have to be increase or decrease of manpower. We are doing some advanced work before the bulldozers are sent in. We are not going to do 2 at the same time, so there will be a lack of time. That is why we are doing the advanced preparatory work. In other words, when you come to seek funding formally, you will have the overall project plan and also establishment planning. This is only for upgrading part of the project, and afterwards they will have to come for funding support for the construction work. I'd like to know the manpower side of things, the establishment. Undersecretary, I hope you will also get hold of the information about manpower and medical services arrangement before you come for actual funding request. Yes, in fact, I can add a little. At this stage, we may not have the actual figures, but we are paying attention. And I can let members know that within the Bureau, we have overall manpower planning. As you know, we lack medical staff. And I'm not just talking about doctors and nurses. There are 6 other professions being looked at. I hope there will be a report soon so we can do something about training, and so that we can have manpower enough for existing services and then prioritize other services. Mr. James Toh. Chairman, we have discussed this project for a long time, and a lot of details have been taken up with the administration, whether at district council level or at LegCo. Now you are seeking funding approval, and I'd like to talk about your connection with the MTR. At what stage are you, Mr. Lee? We are still having initial discussion with MTRCL. We are investigating the feasibility. The MTRCL said that it is technically feasible. But if indeed there should be a connection, the cost might have to be apportioned, and perhaps the MTRCL, since it is experienced, might undertake the project, but we are only at the discussion stage. If there will be this connection, the cost will not be reflected in this kind of funding request. Is that right? Is it that other government departments will have to support you in principle? We have not gone to that stage yet. We are still at the technical stage. So we have not gone to where we can seek the resources or funding. I'd like to ask other parts of the administration who can make a decision on this. Have you received any initial request for policy support? Because I think it makes a whole world of difference whether there is MTR connection to Kwong. Undersecretary. Thank you, Mr. Toh. We are still at the preparatory stage. As Mr. Lee was saying, we are still only undertaking discussion. And we have heard that if there could be an MTR connection, it would be so much better. We'll factor in this view and iron out which government department might have to be involved in the discussion. And we'll have to think more about the resources. Chairman, I'm not saying that it will be good if there can be a connection. I hope that now that we are undertaking redevelopment, you have to make the connection a fact. If in the end the MTRCL is not willing, then society will take it to task. But I'm just asking the administration, you support the Tung Hospital, and only a few parties are involved, right? The Tung Hospital can make a decision, the HA, and also the administration can make a decision. Is it that the 3 are agreed that this should be the direction to take, or is it just an objective kind of possibility, or is it that you already would like to go down this route? And if there is no agreement, which entity out of the 3 is not willing? Undersecretary. Mr. Toh, at this stage, we are still exploring, and I can say we are still going down that direction, or else there will be no exploring. We are looking at the technical possibility, and we can only know after exploration is done. I think this is the major premise.
Well, I have conveyed this message for a number of years already. So what have you been doing all this time? We have to hire design consultants before we can carry out a detailed investigation. Yes, we have heard the voice of the community. That is, they want a connection from the MTR to the hospital. So while we do our master planning, we can liaise with the MTR and see if such a connection can be made. Well, in our master plan, we can continue to explore this. So has there been a view that this should not be done? Now, they have already conducted an initial study. So in your initial study, did anyone say that it should not be connected? No. Mr. Ho? Thank you, Chairman. Yes, we support this redevelopment plan because Kwong Hospital is serving many people in Kowloon West, and Kwong Tai Sin Hospital is pretty old and it does not provide enough service. So we really support this redevelopment project. Now, for the funding, you are only upgrading part of the project to Category 1, and what's included under this is a decanting project. So for the decanting works, how can you continue to provide service to patients? Because the patients would be living in the middle of a construction site. And also you would have to relocate quarters, and machines would have to be removed, etc. And for the decanting works, it will cost $130 million, and it's about 1/4 of the whole sum you are seeking now. Now, of course, I understand that you have to hire a consultant first before you can give us a detailed plan. But for decanting works, how come it costs $130 million? If you just give us the information under paragraph 19, I don't think we can be satisfied. So I hope that the administration and the hospital can provide us with more information. Well, you are going to submit a paper to the finance committee, so can you provide more detailed information to us? Now, I understand that you do not have a detailed plan right now, but at least you are earmarking $130 million for the decanting work. So let us know how this sum will be spent. I'm not asking for every single detail. I understand that it's not possible right now. But how will the $130 million be spent so that we will know how much the patients will be affected? So if the administration and the hospital cannot give us an answer now, please provide the relevant information in the paper submitted to the FC. There's no problem with that. Yes, we can supplement that information. Ms. Wong Bit-Wen. Thank you, Chairman. I would like to follow up on Mr. James To's question. That's about the connection with the Yau Ma Tei MTR station. Yes, we support the redevelopment project. And for most of the increased GFA is for the ambulatory service, and there will be a 5.1-fold increase in size. As for hospitalization, the area will only be increased by 1.8 folds. So would this assessment be too conservative? And if in the future there are not enough beds, then will some space of the ambulatory service be converted into inpatient space? And now you want to provide more ambulatory service. And I'm sure there will be a lot of patients visiting the hospital in the future, and many of them will be taking the MTR. And now if you want to go to Kwong Hospital, you can either enter the hospital through an entrance on Dundas Street or on Waterloo Road. However, these entrances are quite narrow, and also you have to cross the roads, and there's no shelters from the elements. So can you do better in terms of design so that there will be a connection with the MTR? And also I would like to ask about geriatrics. Now it is accommodated in Choi Chin Tong outpatient buildings, and there is a senile dementia specialist clinic there. It's a very good clinic. I have been visiting there with my mother. But there are only 2 doctors on duty there. However, for dementia patients, they have to undergo a lot of assessments and they have to answer a lot of questions, and these patients cannot go there by themselves. They have to be accompanied by their family members, and we always have to wait for a long time in these clinics because the queues are really long. So for the redevelopment of the Kwong Hospital, this has not been mentioned. You have not mentioned the memory clinic under the geriatric department, but this is really a very important department. It serves the elderly in the whole Yau Chim Mong area. We are not just talking about the buildings aging. Actually, the population in the district is also aging, and there is a long queue for this service. So after the expansion, how about the geriatric service? In Choi Chin Tong outpatient building, will this service be enhanced in the future? Now, there will be more elderly in the district. Have you assessed the needs in the future? I really appreciate your work, but now it's really very crowded, and there are just 2 rooms there. And also for the ambulatory service, there will be an oncology center in the future. This is also a very good design. Because for cancer patients, after their surgeries, they would have to go to Princess Margaret's Hospital for chemotherapy. And Kwong Hospital has an advantage, that is, it has a Chinese medicine clinic. So for cancer patients, after their surgeries or before their surgeries, can they choose to be treated by both Western and Chinese medicine? In other words, the oncology department in the future would have a close connection with the CM center so that patients can have a choice as to whether they want to use Chinese or Western medicine after surgeries. So I would like to thank Ms. Wong for her questions. You asked about the arrangements inside Kwong Hospital and you want more detailed information. So maybe I can ask Dr. Watt to answer these questions. Yes, I understand that the elders really need a lot of healthcare services. So this is one of the major reasons why we are redeveloping Kwong Hospital. So no matter whether it's hardware or software, we have to make improvements. Just now we have talked about our new services, for example, ambulatory service center and also non-radiological cancer treatment, etc. Most of the users will be elderly. So other than the memory clinic, we will also be providing services in a comprehensive manner. So we are not just thinking about the elderly, we will think about all the patients. We will make improvements in all areas and we will look at the relevant statistics. Well, you said that this clinic is now very crowded. Yes, we want more space in the future. After redevelopment, there will be more space. As for the relevant facilities, they will also be developed accordingly. We have to progress with the times. So at the moment, what can we do? We can change the modes of service. Well, for some patients, we can provide outreach service. some patients would have to return to the hospital all the time after they are released. So now we have a new way of service. That is, we will assess the needs of the outgoing patients, and then we can provide outreach service to them at their homes so that they don't have to come queue up all the time, and their family members won't have to accompany them. I cannot give you too many details right now. As for chemotherapy and a choice between Western and Chinese medicine, well, the Kwong Hospital has this advantage. We are combining Chinese and Western medicine, so that's why we can have better development in the future. As for the deployment of beds, I think we can adopt a more flexible approach in the future. As for ambulatory service center, it takes up a lot of space. Why is that? Because now it's really constricted. So we should not adopt the present standards. So that's why we will provide much more space in that area in the future. How about Chinese and Western medicine? Well, because it's a professional decision, and it's also a choice of the patients and the healthcare staff. So we are open to it. Thank you. Ms. Wong? Yes, I understand that after the expansion, there will be more space and more services can be provided. So can you undertake that the service of the memory clinic will not be affected, because now there's insufficient capacity? So in the future, can you add manpower in that clinic? We will reflect your views to our staff so they can follow up. Members, I would like to remind you that we still have 2 members who would like to ask a second round question. And we have been discussing this item for almost an hour. And many of the questions have already been raised in the relevant panel meeting, and now members are repeating them. Well, but I don't know whether the members who raised the questions attended that meeting, so I let them ask. So at the panel meeting, the PWSC, for the panel, PWSC and FC, they have different scope of work. So I think on different occasions, you should ask different questions so that the efficiency of meetings can be enhanced. Ms. Chen Yunhan and Ms. McMakin would like to ask the second round question. I would like you to ask questions in one go, and then the administration will answer. Chairman, first of all, I was not a member at that time. It was discussed in June, and at that time I was not a electrical member. Yes, that's why I let you ask the questions. I would like to clarify this point. And I would like to tell the Undersecretary. Now, we have to support this project because there is a need in the community. But you need to provide service, and you need to do construction at the same time. This is really magical. Now, the Census and Statistics Department has a huge problem now, so I really don't have much confidence in the figures right now. So I would like to ask the Undersecretary. Now Kwong Hospital is going to be redeveloped, and now we are so worried. I think the administration would have to take up this responsibility. In Kowloon East, we know that there will be construction of Children's Hospital, and so why don't you do that first, and then later on you will do the redevelopment of Kwong Hospital? Well, we will support its redevelopment, but I'm worried that in the coming 10 years there may be medical incidents because of the constructions. Well, as McMakin said just now, we have a grave concern. It is a very difficult situation for both the healthcare worker and patients. You're repeating yourself. Just now, Dr. what did not answer my question squarely.
You really have to face up to the issue. You said you would consider it, so never mind. My question for the Undersecretary is, you said that in every cluster there are hospitals, but Kowloon East is a mammoth hospital. You have Princess Margaret, Yan Chai, and also Lady of Maryknoll. And as you know, many of them are heavily patronized and they're popular. Princess Margaret and Yan Chai and Kwong, the three hospitals have undergone redevelopment or will undergo redevelopment. I think you should consider why in certain clusters the hospitals are constantly being redeveloped, but then in other hospitals there is very little patronage, like Our Lady of Maryknoll in Wong Tai Sin. There is no emergency and accident department. Why don't you expand the scale? Why don't you only always concentrate on these three big popular hospitals? Why do you continue to redevelop them and leave the other hospitals unattended? This is a super mammoth cluster, but you are still only relying on these three big hospitals. I hope the hospital authority will talk about division of labor within the clusters. Look at Kowloon West. Tsuen Wan, Kwai Ching, Tung Chung people all come to Kowloon West. They have to consult an eye doctor at Characters Medical Center. I don't know how you map out your clusters. I am sure the Bureau will have to take this up with the hospital authority in the long term. Undersecretary. Thank you, Ms. Chan and Ms. Mack, for your constructive views. Ms. Chan, you mentioned why Kwong will remain in the same district, and you also mentioned the Children's Hospital to be built at Kai Tak. In terms of proposals and construction projects, these were carried out since the last administration, and the Children's Hospital now has been the subject of a tender called, and so there may be no going back on some of these projects. But at Kai Tak, well, today we are not discussing Kai Tak, but at the Bureau, we are thinking whether, in terms of design, actually, besides the Children's Hospital, there is still land for two other hospital facilities, and whether we can prudently look at the needs of the entire district, because apart from Kwong QEH does have its own aspirations. And also with regard to Ms. Alice Mack's question about the clusters, I think at the very early stage, when the HA designed the 7 clusters and what hospital should belong to what cluster, it was because of the needs at that time and the outbreak of disease information at that time, and also views of the public. The design and arrangement put in place then might have to be looked at again because of the change of the times and the change in need. Ms. Alice Mack says that one particular cluster may be mammoth, and whether we would like to rearrange the clusters because of a change in need. We are looking into this. I can tell you that we are looking into this. But now we do not have anything concrete yet, because hospital reconstruction, redevelopment, and also the new Kai Tak site are being looked at, and I have heard you will factor in your views to our discussion process. Right, thank you. I hope the Bureau can consider these views when you have future hospital redevelopment projects, because hospitals are unique in that if there is already a lack of facilities, and yet if you want to pull down the main service building, there will certainly be some impact. And later on, if you undertake these projects, perhaps you can have relocation or resiting of the hospital. That would be more ideal. Okay, that's all for discussion of this item. Members, those who are in support, please raise your hands. Thank you. Those against, please raise your hands. I am of the view that the majority of the members voting are in support. Ms. Sit-ho has asked that this item be singled out for voting at the Finance Committee. That will be recorded. I'd like to remind members that we have two other items that we are asked to endorse. One is Tin Shui Wai Hospital. The other one is relocation of parts of the DOJ at former CGO. And hopefully these two can receive endorsement at the moment. Next paper, PWSC 2012-1347. This is a proposal to upgrade 73 mm to Cat A and an estimated cost of $3910.9 million in money of the day prices for the construction of Tin Shui Wai Hospital. The administration consulted the Health Services Panel on the 19th of November 2012. There was general support from members for this funding request. The main points of discussion have been tabled at the meeting. Attending for this item, we have the following officials. Professor Sylvia Chan, Undersecretary for Food and Health, Ms. Angela Lee, PAS for Food and Health, Mr. Leung Kun Kei, Director of Architectural Services, Ms. Chan Hoi Ming, PD2 ASD, Dr. Tony Koh, HCE of HA, and also Donald Lee from the HA as well, Chief Manager, Mr. Leung Chi Chang. Thank you, Chairman. I support the project. However, there are some facilities that cause worry, and that is accessibility. Within the project, some costs, namely about $30 million, would be spent on providing a lift to connect the light rail with the hospital. If I am correct in my estimation, it would be the addition of a lift at the existing footbridge at the light rail station. You can imagine, if you only have a lift trying to tackle the accessibility issue of a hospital, I think you can only tackle part of the problem. Yes, you are going to provide barrier-free access, but most people would still have to go from the light rail station and then into Tin Wai Estate before they come back out. It is a convoluted way, and since I frequent the site, many people are already frequenting that site now, and space is rather limited. So how can you solve the problem for people who take the light rail to access the hospital? This is a major issue. At the District Council of Yuen Long, we have strongly requested that there should be another access from the hospital to Tin Ying Road, but we have got no response. And the original pedestrian access is very narrow, including Tin Tan Road. It's a carriageway, but you have not considered widening it. This again causes worry, because this is going to be a general hospital with a few hundred beds. What account the accessibility? Who can take the question? Mr. Lee. Mr. Lee, please. Thank you, Chairman. We propose to provide a lift at Chung Fu Light Rail Station so people can access the pavement on Tin Shui Road. So light rail passengers do not have to go inside Tin Hua Estate, because right now there is just one lift in Tin Hua Estate. By so doing, we believe people coming in on the light rail can walk along Tin Shui Road, so they do not have to traverse Tin Hua Estate. There was a proposal to provide vehicular access on Tin Ying Road. At the initial stage of the project, we have done a TIA, and according to figures, we believe the trunk roads there would already be able to take care of the additional flow of traffic. The DC registered a worry, saying that at the junction of Tin Shui Road and Tin Tan Street, if there is an accident, will those roads be closed off? The consultant said that the roads are quite wide and the possibility of road closure is low. So the present proposal doesn't include providing a flyover at Tin Ying Road. If we want to add a flyover, we have to do a lot of technical assessment, and it may delay the hospital project by 4 years. This won't serve the public well. Therefore, we are not proposing to provide access from Tin Ying Road. Chairman, another question. Can Tin Tan Road be widened? And also, from the lift, can you have a covered walkway built? Mr. Lee, I don't know whether the ASD can take this technical question to provide a covered walkway. Mr. Leung. Mr. Leung, any problem to provide a covered walkway? We have to consider this in more detail. Right now, this is not within the project parameters. Mr. Frankie Yik. Thank you, Chairman. To people who live in Tin Shui Wai, the population figure stands at 290,000. They are relying on New Territories West cluster, and hospital services are hugely lacking. The Liberal Party therefore supports the building of this hospital. This is going to be a general hospital, and from the figures in the paper, we can see that in the use of hospital beds is 89% in 2012. There are 2 beds for 1,000 people, but then the overall figure for Hong Kong is 2.9 beds for 1,000 population. And until March 2012, there are a total of 3,926 beds in NT West, and you only add 300 beds in the new hospital, or 7.64%. My question for you is, how many more people can you serve as a result of building this hospital? And also, what do you expect you can do about the utilization of hospital beds? How much less than 89%? And also, what about the proportion of beds for 1,000 population? Now it's 2%. My general question is, it seems you are not meeting demand at all by building the hospital. That's my question. Dr. Koh. Thank you, Chairman. The bed utilization and provision of beds, as we said in the paper, at Tin Shui Wai, we plan to provide 300 beds. After the hospital is commissioned in NT West, the general beds would increase from 2 beds per 1,000 to 2.5 beds per 1,000. And about beds utilization, it depends on the change in demographics and whether people patronize these hospitals. We will be starting the services at the hospital in stages, and nearer the time, we will have to look at the mode of delivery, and it's not easy for us to make an estimate now. But normally speaking, when there is an increase in hospital beds, we believe there will be some help or relief provided.
Yes, I understand that you may not have the most accurate figures right now, but we can make estimation in accordance with the normal situation, and then you can't say that you will just go and see. So I think you may have some initial figures. Yes, we think that there will be an improvement. Well, in the initial stage, with the increase of number in number of beds, the utilization rate will be increased. Well, the government has not answered this question. That is, how many more people can be served? I believe the residents there are very concerned. Well, the number of beds is a number only, but how many more patients can you take care of? Dr. Ko? Well, in the future Tin Shui Wai Hospital, other than A&E beds, there will also be rehabilitation beds, etc. And our services will be provided in stages. First of all, we will focus on specialist outpatient service and A&E service. And members may know that there is a shortage of healthcare staff in recent years, and the whole project will be completed by 2016. We hope that 2 years before that, we will carry out a more detailed planning so that we know how services can be provided in phases. And by that time, we will have more detailed figures. Because we will have to look at the manpower at that time and what's the division of labor in a cluster, etc. I don't think he has answered my question completely. Well, I think when you make an assessment, you can assess in accordance with the general situation. So maybe you can provide the relevant information to me in a paper afterwards. Dr. Ko? Well, if you answer this way, no wonder why members are not too happy. Now, even though you do not have the finalized detail, you should still have a rough estimation. So at the moment, at least you can give us an estimation. For example, for your ambulatory service, how many patients can you serve, and for your A&E department, how many patients can you serve, etc. You can compare yourself with other hospitals in the same cluster, and then you can give us the relevant figure, so at least we can have a picture. That is, with this hospital, what kind of improvements can be made, and how about the number of beds? How come there are only 300? Why can't there be more? I think patients would like to see this. That is, with the construction of this hospital, more beds can be provided. You can tell us what difficulties you are facing, what constraints you have. And if you answer in this way, members would feel unhappy. So do you want to add anything? As for the constraints of beds, because of the construction constraints, we cannot significantly increase the number of beds. As for the information the member asked for, I will provide that afterwards in writing. Mr. Michael Tian. I would like to declare interest. Well, I am actually a newcomer to the Legislative Council, and in the past, you have been talking about this sum of $3.9 billion, and I didn't take part in that discussion. As a logical member of the New Territories West, well, we have a new hospital. Of course, I should be thrilled. However, when I look at the information, it says here that, well, in early last year, Hong Kong's doctors and patient ratio Well, for every 1,000 patients, there is 1.8 doctors, and in other countries, they have 2.8, 3.2, or 2.5 doctors. And for new registered doctors, 10 years ago, every year we had 400 new doctors, and now we only have 200 odd. And for overseas doctors, well, for the importation of them, the profession doesn't like to see that. Now we only have 100 odd overseas doctors. So we have to rely on ourselves. We have to groom our own doctors. But for the school places, it only increased by 100 in the past year. And I got all this information online. Lately, I've been to the districts, and I visited the residents living near Pok Oi Hospital. They say that for the top 2 to 3 floors of Pok Oi Hospital at night, all the lights are turned off. They don't understand why. Why is there no patient? And we've heard a rumor that actually there's not enough doctors. So there are beds, but there is no doctor. And 1 or 2 years ago, some Tuen Mun young doctors came to me. They said that on average they have to work for 70 or 80 hours a week, and their wives complained they had to leave the job, and there was a dozen doctors living in one go. So the doctor told me that with the construction or with the completion of the Tien Shui Wai Hospital, it will be even worse because the number of doctors has not increased. So I have this question. Yes, we need hospitals, we need beds. That's right. But where do the doctors come from? And we are talking about 2 to 3 years down the road. So can you tell me, in the coming 2 to 3 years, you are going to train doctors locally, or you may change your policy. You can allow overseas doctors to come in. But exactly what kind of policies do you have? Because we are spending billions of dollars on this new hospital, and we will be having new beds and patients are queuing up. But at the end of the day, if there's no doctor, then that will be a huge waste. So can you explain to me, in the coming 3 years, in particular for internal medicine, how can we have enough doctors? Now in Pok Oi Hospital, we do not have enough doctors. And if you add Tien Shui Wai Hospital, what will happen? And also there's a shortage of doctors in Tuen Mun Hospital as well. Under Secretary, I would like to thank Mr. Chen for his questions and that you have told us your observations. As for the shortage of manpower in the healthcare sector, yes, that is an existing problem. As I said just now, we have a committee. And last year, some studies were conducted on 6 expertise fields. And that is about long-term planning. Well, of course, that cannot solve the present problems, but we want to do better long-term planning. Anyway, in the short term, this year we have added places to the 2 medical schools, and 100 new places have been added. But of course, we need time to train these doctors. As for overseas doctors, this is underway, but it's not progressing very fast. First of all, we need to wait for people to apply. Now, for Tien Shui Wai Hospital, do you have to deploy doctors from Pok Oi Hospital and Tuen Mun Hospital to this new hospital? This is a very simple question. Is there such a need? Well, for this question, I think it's too early to ask. Now, you have to complete building the hospital first, and it will take years. At that time, the government may have to make deployment and assessment. Under Secretary? Well, I can give you a preliminary answer. As for deployment of doctors, that may be needed. Because for different specialties, we may need to deploy the relevant personnel. but we will make sure that Port Oil hospitals and other hospitals would not be negatively affected. So you are saying that you will not be deploying or you will not be cutting the number of doctors in Port Oil Hospital and Tim Mun Hospital? That's what you are telling me? Well, for deployment, it will definitely happen. But how about the number? Well, we do not have the detailed figures right now. Dr. Ko, can you answer the question? Maybe I can supplement. According to our past experience, well, of course, deployments may be needed if new hospitals are built. Even though there are new doctors and overseas doctors, they cannot just take up the job immediately. For example, at Tin Shui Wai Hospital, when we launch services in the future, we need to provide relevant trainings to the doctors, and some doctors from Tim Mun Hospital and Port Oil hospitals may have to be deployed to Tin Shui Wai Hospital so that we can form a new team. At the same time, we will try to recruit new people, and our trainings will also be provided to them. Other than Tim Mun and Port Oil hospitals, other healthcare staff may be deployed from other hospitals. Well, this is very important. Now, if the number does not drop, that will be okay. There will be their deployments, I understand, but I hope that the number of healthcare staff would not drop, because now there's a shortage of doctors in Port Oil Hospital already. So I hope that in the future you can come back to update us. So after studying, you have to let us know the action plan, and you have to let us know where the doctors will come from. As for healthcare staff, I think this issue can be followed up in the HS panel. There are two other members who would like to ask questions. We will end our meeting by 10:30, and I hope that the meeting can be extended by 15 minutes so that all the papers can be handled. Ms. Alice Mack, a very simple question. That is for the ingress and egress of the hospital and for vehicular access and pedestrian access. We want the hospital to convenience the residents. However, I'm very worried. Well, if you look at Kwong Hospital, there are a lot of issues to be resolved. So with the opening of this new hospital, if the residents complain that the ingress and egress are inconvenient and also the ambulance entrance is risky, then what will happen? At the panel meeting, we also discussed these. The Undersecretary also knew that. So I hope that while you are planning the hospital, now you still have some time. Maybe you should do a better planning so that you do not have to remedy after the opening of the hospital. And also, in the hospital, I hope that that's the provision of orthopedic services. Well, I just went to Tin Shui Wai on Sunday, and the residents really hoped that orthopedic services will be provided. Because if they are not feeling well and if they have to go from Tin Shui Wai to Tim Mun, it's very far. And A&E service is also important. And from now to 2016, there will be a shortage of healthcare service in Tin Shui Wai. I hope the administration can resolve the interim problems, in particular when it comes to service at night and A&E service. I hope the Undersecretary can listen to these views. Ms. Emily Lau, I agree with Mr. Michael Tian. That is the number of doctors and healthcare staff is very important. We are very concerned about that. And if you are opening new hospitals and there's not enough manpower, what can be done? I think you have to report to the relevant panel regularly on this. And I would like to ask about barrier-free access. And in enclosure 1, we can see a map from the light rail station and from the minibus station, etc., you have barrier-free access leading to the hospital. But if you look at the blue area, it's kind of placed in a strange way. First, you can see the ambulance access. And for those wheelchair-bound patients, do they have to pass the ambulance access first?
And also, we often receive complaints saying that wheelchairs cannot access medical facilities. And also, do you provide barrier-free access within the hospital? Because there are many complaints right now. Later on, when you furnish papers to this committee, I hope you can include a paragraph to talk about barrier-free access. And what about female toilet compartments? Under Secretary, particularly, you should be concerned about this. ASD, Mr. Leung. When we design the project, we will certainly take care of the needs of the disabled, both within and outside the hospital. As for vehicular and pedestrian access, we have considered different options because of the topography. The present option is that ambulances and other vehicles and public hospitals, all these are segregated. From the plan here, we have provided 3 accesses to the hospital. One in enclosure 2 near the top, and another one on the right in enclosure 2. That is just below the ambulance access. And the third one is at the letter B. Those 3 are barrier-free accesses. These can be used by the disabled. As to within the hospital, will certainly follow the regulations in the law. And wherever possible, we will go for even better facilities for the disabled. As for the number of female toilet compartments, we'll follow the need, and we will widen the ratio between male and female toilet compartments. We will certainly meet the basic standards, but we hope to go for a proportion of 1:2 or 1:3. And I'm talking about public toilets. I hope you do a better job, because what you are proposing is still not enough. As for barrier-free access, I'm talking about the platforms, whether they are at the same level. Chairman, many people are complaining that the light rail seems to be deliberate in not providing platforms that can connect with other roads. And what about public light buses and their stops? Is it that if people come on a wheelchair, can they access the hospital with any degree of ease? Mr. Leung? The taxi stand and also PLB bus will be the subject of a design in such that there will be a dropped curb when people alight from these vehicles. The gradient of the dropped curb will be as low as possible. The law says it should be 1:15, but we'll try to go for a lower gradient. What about the light rail? In fact, there are buses and also light rail serving the area. We hope that the relevant parties can review this matter to convenience the disabled. Yes, Chairman. We'll talk to the Highways Department. Well, people are complaining against light rail that it is quite deliberate in not providing barrier-free access. When you go to the Finance Committee, I hope you include 2 paragraphs to address the female toilet compartments and also barrier-free access. I hope this will also apply to the paper on Kwong Hospital, because in that paper you did not provide any indication on barrier-free access. Mr. Albert Chan, I have set these at the panel. There are two views. One, the access. As you can see on Tin Tan Street at the junction there, I'm sure there will be a fighting for space between vehicles and pedestrians in the future. In fact, it is also an emergency access for ambulances. Most people will come to the hospital via Tin Tan Street. That is going to be the main pedestrian access, and yet you allow vehicles to turn in from the same junction. I am therefore worried that there could be a conflict between pedestrians and vehicles. As you know, there will be elderly people, patients, and disabled people trying to access the hospital. Sometimes I just don't understand how you design the roads. This happens with housing estates as well. Very often, car park and vehicular access often conflict with pedestrian access. This can be dangerous, and casualties may result. Secondly, long-term development. At first, we had wanted to find a bigger site, but that was not available. So councillors and residents accepted this site because there is no choice. But I hope you can relocate the FVHD vehicle depot in the long term. It's easy to relocate it. Never mind if you act like a dog in a manger, but reserve this site for the hospital. In the long term, the hospital is not going to serve the population of 300,000. Last, I agree with Mr. Michael Teen about his concern. There shouldn't be any professional hegemony. People's health should not be dictated by a lack of doctors. We will follow this up at another level. We will try to resist and fight against medical professional hegemony. All right, those are just views. Dr. Leung Ka-lau, I'd like to ask the Undersecretary to give me more concrete figures to address the concerns of Mr. Michael Tin and Mr. Albert Chan. How many doctors do you need for this hospital of 300 beds? Mr. Kwong said that there should be 70 doctors. Every year, there are 320 medical graduates. If you are willing to retain the people, you can support 4 Tin Shui Wai hospitals every year. So, Undersecretary, how many doctors do you need for a hospital of 300 beds? Undersecretary, thank you. Dr. Lau, we have the same answer. We think we need 70 doctors. Okay, then. If 70 doctors can already support this hospital, then every year we have 320 medical graduates. In other words, every year you can build 4 hospitals of this scale. It's just that the HA is not willing to retain the personnel. Is that right? Actually, every year, medical graduates do work in hospitals, but then there is a lack already in all the clusters, and so they are making up the shortfall. And also, medical students choose their own specialty as they like, and the degree of insufficiency is not the same for the different specialties. I still have some time, right? Can you also give an account to members as to why there is an uneven distribution of doctors in the different clusters? Only 0.6 doctors in NT West, but 1.3 in Kowloon Central for 1,000 population. Kowloon East and NT West councillors are criticizing you for a lack of manpower. Is it that all these years you have not been transparent in distributing your manpower amongst the different clusters? Why is it that Kowloon Central can have double the manpower in NT West? Dr. Leung, we do not have the exact figures now, but When the hospital authority recruits doctors for the different clusters, it is also up to the doctors to make the choices. Maybe NT West is a remote area. Perhaps not many doctors would like to work there. Actually, the NT West understands the issue and it is trying to address the problem. And I think I can only say so much, unless Dr. Ko would like to add. Dr. Ko, I can supplement briefly. As Dr. Leung said, maybe the mode of service delivery is not the same. Like, for example, Kowloon Central and Hong Kong West, including Queen Mary Hospital. There are more specialist services there. In Queen Mary, we have liver transplant and other services not provided by other hospitals, so they have a bigger manpower figure. And also, as certain hospitals, maybe Kowloon Central is easily accessible and therefore many more people patronize the hospitals. I think this will have some impact on the situation. I can follow up at the HSP. Right, I hope this will be followed up at HSP. Indeed, the lack of medical staff has evolved into a major controversy in society. I hope the Bureau can take this up in due course with the HSP. We only have 5 more minutes. I will put this item to the vote first, and I'll like to see whether you agree to also discuss the next item. I'll put the item to the vote. Those in favor, hands up. Thank you. Those against, hands up. I'm of the view that the majority of members voting are in support of the proposal. The proposal is endorsed. Members, we only have 3 more minutes. I hope this will be singled out for voting at the Finance Committee because I have to know how they answer those 2 points. Okay, the Bureau. Please supplement the information ASAP. We have 3 more minutes. Members, what do you think about the next item? How many members will be asking questions? 4, 5. I think even if I extend the meeting by 15 minutes, we may not be able to process this item. I will rather ask the administration to roll this item over to the next meeting, all right? The next meeting will be one month away. I'm just a little worried. I'd like to ask the director. I think tenders have been called for the main and east wings. Yes. If it is going to be 1 month down the road, it means we can go to the FC only in March. Will that be a problem? Our estimate is that if there is approval by FC, we will start the works in April. Members, what do you think? Time is tight. If you are not going to ask major questions of principle about this paper, then perhaps we can do an initial exploration and then we give endorsement in principle. As to other questions, we can take up at panels later on. What do you think, Chairman? I propose you hold another meeting, maybe next Wednesday in the morning, if they think they don't want to wait another month. But I don't think we should just give endorsement in principle. Any other questions? If not, we will try to arrange a special meeting. May not be on Wednesday, maybe on other days of the week, right? I will try to find some time with the clerk. Okay, that's all for the meeting. Meeting is adjourned.